Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with abdominal pain. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Now remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with abdominal pain. Remember, there are a lot of different organs in your abdomen, so your doctor has a lot to think about. We'll cover a few items here. This is what your doctor is thinking. First thing is, could it be an abdominal infection of any sort? This includes, but is not limited to, appendicitis, an infection of the appendix, which is a small little tube at the beginning of the large intestine. Diverticulitis, which is essentially an infection of the walls of the colon. To be specific, sometimes the colon can have little outpouchings, and those can become infected. Your doctor is also considering cholecystitis, an infection of the gallbladder, which can be due to gallstones, hepatitis, an infection of the liver, and even an infection of the kidneys, also known as pyelonephritis. Additionally, pancreatitis is a consideration. It's important to note that in pancreatitis, it isn't always an infection, but is more so general inflammation of the pancreas. These are all localized infections, meaning they are in one location. However, some infections can spread through the entire abdomen, causing something called peritonitis. I'm not trying to scare you, but these are things your doctor is always thinking about. Other things on your doctor's mind can include bowel obstruction, which occurs when something is blocking the passage of digested food through the intestines. Your doctor is also thinking about a variety of other causes, including inflammation of the esophagus, stomach, intestines, and bladder. To make it more complicated, your doctor is also considering any issues with the aorta in your abdomen. Now, your aorta is the largest blood vessel in your body, and issues such as dilation or rupture of the aorta can occur. Your doctor is also thinking of anything that would cause limited blood flow to your abdominal organs, known as abdominal ischemia. If you're a chromosomal female, we're also thinking of the ovaries, which can go through something called torsion. This is a dangerous rotation of the ovaries, or you can even have infections of the ovaries. If you are a chromosomal male, we're always thinking of testicular issues, also including torsion or infection. We've definitely left out hernias, abdominal strains, fluid in the abdomen due to cirrhosis, and a host of other issues that would be too complex to cover here. Based on your history and exam, your doctor may also be considering cardiac issues, which sometimes disguise as abdominal pain. Your doctor will likely get blood work to check for signs of infection or blood loss, and also a panel called a comprehensive metabolic panel, which checks electrolytes such as sodium, potassium, calcium, and also checks on your kidney and liver function. You may also have to provide a urine for testing. Please make sure to do that quickly to shorten your stay in the emergency department. This gives your doctor more information regarding any urinary infections or blood in the urine, which can signal passing kidney stones. If your doctor believes it's necessary, they may also order a CT scan of your abdomen to evaluate for further concerns. Trust your doctor's judgment and realize that not everybody needs a CT scan. Finally, If your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. Depending on the cause of your abdominal pain, your doctor may encourage you to follow up with a GI doctor. This is because sometimes ulcers in the stomach and beginning portion of the intestines, called the duodenum, can cause pain. And there is no way to identify this in the emergency department. You would need direct camera visualization by a GI doctor. I know that being in the emergency department can be an incredibly stressful experience, and I hope this has been helpful for you. Again, this is Dr. Karl Yousef, and wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.